Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to be doing an NCLEX review over celiac disease. This video is part of a gastrointestinal NCLEX review series, so be sure to check out the other videos in this series. And as always, in the YouTube description below or at the end of this YouTube video, you can access the free review quiz that will test you on celiacs. So let's get started. So what is celiac disease? Celiac disease is an autoimmune gastrointestinal disorder where when the person eats something that contains gluten, and gluten is found in wheat, barley, rye, and they ingest that and it enters into the small intestine, it causes an immune response, which in turn damages the intestinal villi. And you're going to learn in this lecture, intestinal villi are so important because they play a role in absorbing nutrients. So first, before we dive into our lecture, let's talk about the key points you need to know about celiac disease. Okay, with celiac disease, we're really concentrating on wheat products and things that really contain gluten because that is our big problem. And wheat consists of several proteins, and the protein that we're interested in is gluten. Now, gluten itself is made up of a group of proteins such as gliadin and glutenin. What we're really concerned about in celiacs is gliadin. So remember gliadin. Okay, why? What happens is that gliadin, the body is unable to properly break down gliadin. Gliadin is a protein and it's made up of amino acids, and the body can't break those down properly, which we'll really talk about in the patho part, sends off an immune response because your body views some parts of that amino acid that it can't break down properly as a foreign invader. And in the process of that little war with your immune system and the gliadin, it kills the villi. Now, celiac disease tends to be genetic and it will run in families. So mom, dad had it, your patient is having signs and symptoms of it, they may have this because it runs in families. And it occurs in both adults and children. So you want to screen your pediatric patients for this as well. There is no cure. A patient who has celiacs, they will have to, for their lifelong, follow a gluten-free diet. And this will be consuming foods that have no gluten in them and substituting things, which we'll go over in depth in the nursing interventions. And by doing this, this will allow the intestinal villi to heal and increase their nutrition intake, because once those villi are damaged, the person is really at risk for malabsorption. And celiac disease is different from a wheat allergy or a gluten sensitivity. They may have the signs and symptoms, same signs and symptoms as someone with celiacs, but the damage to the small intestinal villi is not as severe as it is in celiac disease. Now let's look at what is going on in celiac disease. Who are key players and why is this happening? Okay, so we have a patient. They may have celiac disease and they ingest a wheat product. Well, we know from earlier that wheat is made up of some proteins. Specifically, what we care about is gluten. And gluten is further made up of some other proteins, specifically glutenin and gliadin. And gliadin is what we really care about because this is what's causing our immune reaction. And what is gliadin? Let's talk a little bit more about it. Okay, gliadin is a wheat prolamine, and this is a plant storage protein that is high in amino acids. And what are amino acids? What do they do? Amino acids give your protein its structure. It also helps with storing and transporting nutrients. Now, these specific amino acids that we're talking about in celiac disease that make up gliadin are proline and glutamine. So what's happening in a nutshell is that the body is unable to break these amino acids down properly, like how it normally should. And instead, they're not broken down correctly. They pass through that gut cell. The immune system sees that and thinks it's like a foreign invader, like a virus or bacteria, and attacks it. and makes antibodies. And in the process of doing all that, it kills the intestinal villi. So let's look at how normally the body would break down a protein. Okay, here we have our long strand of amino acids which make up the protein. Those are your little circular areas, your amino acids. Now normally whenever you ingest this, your body has all these specialized cells that will take these amino acids and pull them apart. Each are assigned to take certain parts of that chain apart, and it breaks it down into single amino acids. That's what should happen normally. Well, in celiac disease, that's not what happens. Whenever they ingest that gliadin protein, the amino acids that break up the gliadin don't break apart into these single little amino acids. Instead, it breaks down into this short little chain known as a peptide. And whenever this crosses that cell, that immune system proceeds to attack it. And when the immune system does this, its main objective is to kill this gliadin. So the immune cells see the gliadin and it's like, we've got to get rid of you. And the gliadin will react with the TTG enzyme, which is the tissue transglutamase enzyme. And whenever this happens, antibodies will form. And these antibodies are made, so the next time this patient ingests gluten, there will be an army on standby to go and to attack that gluten. You'll have this continuous cycle over and over. And the antibodies that are produced, as a nurse, I would be familiar with these antibodies because if you have a patient who's being checked for celiacs, whenever the doctor orders these specific tests, you'll know why, because it's like, hey, these are the antibodies being produced whenever this immune system reaction is going on. So the antibodies produced are tissue transglutamase antibody, TTG, antibody IgA, and endomycyl antibody, which is EMAs. Now, the antibodies will be formed during all this raging war going on. You have the unlucky bystander, which are your intestinal villi. Now, to help us understand the signs and symptoms we're going to see in celiacs and why we need them to avoid gluten, we need to understand the role of the intestinal villi, because this is why the patient is really getting so sick, because these guys are gone and they're not being able to do their function. So what is their function? Okay, the villi are found in the small intestine and they have a unique look to them. They are finger-like projections that aid in the absorption of nutrients. And how they do this is by increasing the surface area for absorption. So they have nice long protrusions which give them that surface area. And whenever they become damaged, flattened, they lose that surface area. So you lose the amount of area for nutrients to be absorbed. Now, they are surrounded by a network of blood vessels, and this helps easily for that nutrients that's being absorbed to enter into that bloodstream. And each individual villus has enterocytes, which are those cells that aid in absorbing food and aid in digestion. Now let's look at a picture of what happens to those villi in someone who doesn't have celiacs compared to someone who does. Okay, so over here on the left, you see the opening of the small intestine. You see those finger-like projections, those are your villi. And then the middle picture is just a villi blown up, and as you can see, surrounding it is that network of blood vessels that's helping absorb, taking that nutrients that's absorbed and taking it through the bloodstream so the body can use it appropriately. Now, the picture on the bottom is a picture of what normal villi should look like. They're tall, they have those finger-like projections, which help with the increased surface area for absorption of food. Now, the top picture is a picture of someone who's been eating gluten, and the body does not like that, and the immune system has attacked that area, and notice how they have completely just flattened, and you have the dead epithelial cells. It's just not working appropriately, and this is why you're going to see a lot of malabsorption complications in these patients. Now, when the patient quits eating gluten, over a long period of time, these villi will start to repair themselves, and they'll start to grow back, and the patient will be able to absorb food. But as long as they're taking in gluten and they're having these reactions, the patient is at major risk for malnutrition. Now let's look at the signs and symptoms of some things you may see in a patient with celiac disease or they may report to you. And to help you remember these signs and symptoms, remember the word malnourished, because that is the whole reason these patients are getting sick with celiac. They're malnourished. Those villi are not working appropriately. We can't absorb our nutrients. Okay, so M for mouth ulcers. Inside the mouth, inside the lip, they may have ulcers that have formed, so your patient may report that to you. A for anemia, low red blood cells. Why anemia? Well, what's happening is that your body is not able to absorb all those vitamins and all those minerals that it needs. And with red blood cells, you need a good supply of vitamin B12, you need a good supply of folic acid and iron, and the body with celiac isn't absorbing that. So they will have low red blood cell production, which will lead to anemia. Also, L for lactose intolerant. Many times patients who have celiac, they will not be able to tolerate dairy products. These two tend to go hand in hand. And that's because they've lost that ability to digest that enzyme in dairy products, the lactose. So they'll have the diarrhea, all that classic signs and symptoms that go with lactose intolerance. But as they remove gluten from their diet, those villi heal back, they can tolerate dairy again. N for nausea and vomiting. O for osteo changes, that's your bone changes. Again, the body can't absorb good amounts of calcium or vitamin D, which play a role in bone health. So they'll have thin bones or fractures. U for unexplained slow growth and puberty. And this is really in your kids. All of a sudden a parent may report, the doctor may assess and see the patient's really not in a good percentile for their height, or they haven't started menstruation in girls, or something's going on. And in adults, they may have weight loss. And again, this just is coming from that inability to absorb that nutrients that plays a role in allowing a child to flourish and grow. Okay, R for rashes. With celiac, you will see a very unique rash on these patients, and it's called dermatitis herpetiformis. And this is a type of rash that can be found, it's blister type bumps that can be found on the knees, the elbow, the backside, or the hairline. And the patient will say it is very, very itchy. And that is present with celiac sometimes. I for irregular periods, and another I for irritability. Again, just don't have the nutrients for regular menstruation, and being low in a lot of those vitamins can cause depression and mental health problems. S for stools will be greasy, like an oily appearance to them, and very odorous. H for hair loss. E for enamel changes on the teeth. You may see yellow or brown spots or deformed parts of the enamel. And then D, the last one, diarrhea. Patients can have that as well. Now, let's talk about how celiac is diagnosed. As the nurse, you need to be familiar with what the physician may order so you can talk to your patient about if they have any questions, okay? We talked about those antibodies that are formed in the pathophysiology part. So physician may order like a blood test, like a TTG, an IgA serum, or an EMA, or they will order, or do both, an endoscopy where they take a scope and they'll assess that upper GI tract down in the small intestine, and they may take a biopsy of the intestinal villi, look at that under a scope and see what they look like. Do they look abnormal? Are they flat like that picture we looked at? And if so, celiac is probably present. Okay, now let's talk about the complications, okay? With celiac, we know big thing they're going to have is malnourishment, and this is going to affect every body system. We're going to have bone problems, skin problems, mental problems, growth problems, and reproductive problems. Everything's going to be affected. Also, another complication is that the patient has an increased risk of cancer like lymphoma. And sometimes these villi never heal back. They're gone forever. And that is termed refractory celiac disease. And if the patient gets this, they'll never be able to really absorb the nutrients from their food. So they'll need some type of supplementation, like through an IV. Now let's look at those nursing interventions. What are you going to be doing for a patient who has celiacs? Okay, our biggest role as the nurse is to really help them understand what this diagnosis means and help them with their diet, because they're going to have to really adjust their food around to help make sure that they avoid gluten. So first, let's talk about assessing. We want to assess our patients, of course. Screen them. Are they at risk for this? Do we need to let the doctor know so they can maybe order some tests? So we're going to assess our patient, and if they report, I'm having a lot of abdominal bloating, diarrhea, mental fog, you need to ask them, well, when do you notice these signs and symptoms? And what foods are you eating whenever these signs and symptoms come on? So you might want to have them keep a food diary along with the signs and symptoms. So whenever you look at that diary, you can see that they ate some pizza, and then they had a sandwich, which is all high in wheat, and then they had these signs and symptoms. So it's correlating. Assess their skin for that dermatitis herpetiformis, their teeth, they got any enamel changes, or their mouth, they have any sores in there. Also ask, do they have a family history? Does mom or dad have it, sister or brother? Then you want to assess their knowledge of celiacs. How well do they understand this? And their knowledge of gluten, and especially their knowledge of what foods contain gluten, because it's really an eye-opener to see how many foods out there really contain gluten. So you want to see where their knowledge is. Then you want to assess their ability to read the food label, especially the ingredients part. A lot of things will have a humongous paragraph of ingredients, and they literally have to look at each ingredient, make sure it doesn't contain some of these things. And whenever a parent has a child who has celiacs, they have to be really careful with this. They have to read every food label, and you want to show them how to do this because they don't want to give their child gluten. And you got to educate them that they must avoid any foods with gluten so those villi can grow back, and let them know why they need to do this, because what's going to happen in the body when you avoid eating gluten, your intestinal villi are going to grow back, you're going to be absorbing food better, you're going to feel better. Now, another thing is, as a nurse, we're going to be implementing the gluten-free diet. The doctor will order this, so you want to make sure that the patient's food tray has the right food on it, and that if family members are bringing them food, that they're not bringing them food that contains gluten, because again, there's a lot of things that have hidden gluten in them that you're not really aware that it has in it. So you want to make sure that. And administering medications per physician's order, like those supplements to help with those vitamin deficiencies. Now let's go over quickly foods that don't contain gluten versus foods that do contain gluten. And this is a list, but you can even take this even further, but for testing purposes and NCLEX, let's hit the highlights. Okay, so foods that don't contain gluten, that's safe for them to eat. Any plain meats, like your fish, your poultry, and your beef. Anything that has breading, the patient needs to stop and think, is this wheat breading? What type of breading is this? Because chances are it's wheat and it has gluten. But nowadays, grocery chains and restaurants are really expanding their gluten-free options. And they're using like rice flour, corn flour to bread their things that they can eat which don't contain gluten. So have the patient keep that in mind. Grains that are safe for a patient to have are like rice. They can make rice flour, corn, soy, millet, tapioca, chai, buckwheat. And really in the gluten-free diet nowadays, they're taking these grains. They're able to produce pasta noodles, breads, things like that, cookies, make cookies out of that. So it can really expand the diet for the celiac. Your plain fruits and vegetables, nuts, beans, legumes, and dairy, but just no malt in the dairy. However, I have an asterisk by this because remember, patients who have celiacs, they may be lactose intolerant, so you want to be super careful with that. Okay, foods with gluten, your typical foods that will contain this, anything with wheat. So watch out for that. Don't get buckwheat confused. two completely different things, but if you see the word wheat, unless it's not in the word buckwheat, don't need to have it. It contains gluten because we learned that all those proteins make up wheat. Barley, malt, beer, rye, pasta noodles, seasonings. A lot of seasonings have that hidden gluten additive just to give it that thicker consistency. Soups, especially your canned soups, will have wheat in them. Any type of breaded foods, unless it's made with this type of grain, and it's usually labeled gluten-free. So you want your patients to really look at the labels to see if it says gluten-free, because manufacturers are getting really good about putting that on there. And anything that looks like a bread type thing, like a crouton, crackers, cookies, bread, dough, most of your cereals, and oats. Oats themselves really don't contain gluten, but they're processed and they're around items that do contain gluten, so they can become contaminated. So they can eat oats if they're specifically gluten-free oats. So keep that in mind. And really let your patients know that most foods that are just processed probably contain gluten. So always look at those food labels very, very closely. Okay, so that wraps up this lecture on celiac disease. Thank you so much for watching. Don't forget to take the free quiz and to subscribe to our channel for more videos.